Hello everyone, you are all welcome to lecture number 1265, and today's topic is in continuation of the highest health risk factor, that is called chronic inflammation. And today's topic is the role of WBC, that is white blood cell, and cytokine in chronic inflammation. And I have already discussed yesterday what is chronic inflammation or acute inflammation and what are their symptoms. That I am going to show you the images of those symptoms. Here it is the symptom of inflammation, and that is either wound or some blood stain or some swelling. It is acute inflammation. Still it is not chronic inflammation, and it is temporary. It can be recovered within 2 weeks or 1 month time. Yeah, this is actually acute inflammation. That is when you get some injury or maybe some attack by virus or bacteria, and where your blood vessels or your muscle cells, they are damaged, and that is in the form of microparticles. And once they become in microparticles, and when blood is passing through it, that is what you will get burning sensation or pain. And that's why a lot of WBC and cytokines will be rushing to that spot, and because of that it will become red or there will be swelling. Now this is the condition of chronic inflammation. In serious condition where your body organs like kidney, like heart, liver, lung, and they have started getting damaged, and damaging is shown in small particles, and really it is serious condition where you may get kidney cancer, liver cancer, blood cancer, or you may get heart attack. There may be chance of plaque formation, blockage. So if you see, all are directly or indirectly linked to your chronic inflammation inside your body, which is slowly destroying you, but you will not notice, you will not understand. This is also another chronic inflammation condition where your joints, ligaments are affected, and you will be suffering from rheumatoid arthritis or arthritis. And it is only because your ligament or cells around that bone is under inflammation, or they are damaged and they are in the form of microparticles where the blood is passing, and then you will get a deep pain or very sharp pain which is unbearable. These are the cardinal signs of inflammation, that is acute inflammation, either by sunstroke, sun heat, or by some injury or by some heating, and you will get some swelling or reddish in color or some color change, and the pain is because of the damage of your cell around the injured area where the blood is flowing. Here it is very clear slide image that how you get the pain. Those are upper layer, it is shown in segment, and it has got some damage particles because of some injury or because of some sickness, and once blood is passing through that in between those two blocks, then the serious itching, burning or pain will start. So here I have given some latest report of WHO, how the 75% death are caused by different type of diseases, and they are all directly linked to chronic inflammation, and it is the advice of World Health Organization WHO that once you have chronic inflammation, it means you are having high risk of getting first is heart attack, heart problem, and that I have already discussed yesterday how in India, not only in India, in many parts of the world, very young people are getting heart attack in the age group of 20s, 30s, and the global population is confused of stress, strain, or overwork, but it's not like that. Such cases now, in latest research, it is found that they were suffering for many years with chronic inflammation and they could not notice, they could not understand. And because of that, slowly they got heart attack, they got cancer, they got diabetes, they got Parkinson's disease in young age, they got depression, anxiety, and also Alzheimer's disease. So here the reports are given here. The key points from WHO: non-communicable disease, NCD action plan from 20 to 13. So according to that, the WHO has advised that we have to be careful of chronic inflammation, and this chronic inflammation is actually directly linked to different type of diseases, and up to 75% of diseases according to WHO report are linked to chronic inflammation, and because of that millions of the people are dying every year in the world. Now, B, World Health Assembly Declaration 2011, WHO emphasized control of chronic inflammation, prevent diseases. C, Global Health Risk Report of WHO. Recently, they have given the report that WHO identified chronic inflammation as a high-risk key factor for non-communicable diseases, that is NCDs, and counting for 36 million deaths. That 36 million deaths is only some 1.5 years ago. I am sure it must be around more than 40 million today in 2024 deaths. It is because of the chronic inflammation. So I have given some of the data published by WHO, impact of chronic inflammation and death. Number 1, cardiovascular death means those who are dying out of heart attack or heart failure, that goes to 20 million per year globally, and that is only because of chronic inflammation. And number 2, cancer deaths. Cancer deaths are 10.2 million per year. Then diabetes death 2 million per year. Then respiratory asthma, chronic bronchitis, all those related to respiratory deaths, that is 4 million per year. And neurodegenerative, Parkinson's, Alzheimer's, depression, anxiety is causing 140 million global population. So these are all data given, and here I will be discussing the role of WBC and cytokine. When I am saying people are sometimes confused, they think that cytokine and WBC, they are together working. Of course they are together working, but they are not same. WBC is a cell, white blood cell, while cytokines, they are produced by our body immune cells like T cells, dendritic cells, B cells, and they are actually protein molecule that is called your cytokine molecule, and these molecules are, we can say, information molecule, just like networking, just like we have our networking to connect with different information. In our body also, cytokines, they are the information networking of our immune system, and this cytokine is going to pass on the information whether it is good or bad. If it is good information, definitely WBC and others will be rushing towards that side, but if it fails to recognize the pathogens of bacteria or virus, then they will start killing their own normal cells. That condition is called autoimmune disease condition. So in the next lecture, I am going to discuss about autoimmune disease condition. So here, with this I will stop, but my lecture will continue, because I am going to target most of these diseases, how the chronic inflammation is playing very dangerous role, and we are at high risk. And even I will be discussing the specific test that is called C-reactive protein test, whether it is high or low. That is going to determine your condition of chronic inflammation inside your body, which you cannot notice unless you go through a specific test for chronic inflammation, blood test. And it is my advice to everybody, at least once in a year, we should go and check our chronic inflammation condition of body once again. Thank you very much for watching the lecture.